I am Dr. Daniel, and today I want to talk about two things that quietly bother millions of people every single day. And yet almost nobody talks about them in a way that is actually grounded in science. Hair thinning and gray hair. Most of the time you're told it's genetics, it's age, it's stress. Deal with it. And sure, those things are real contributing factors. But what this framing completely misses is the actual biological machinery behind what is happening at the follicle level. Because once you understand the mechanism, you realize that there are real, evidence-based interventions that can move the needle. Some of them are sitting in your kitchen right now. So, in this video, I want to cover both problems, thinning and graying, as two completely separate physiological stories. They have different causes, different molecular targets, and require different interventions. And I am going to give you the honest science behind each one, including caveats, because I am not here to sell you miracles. Let us start with hair thinning. Part 1. Hair thinning, the DHT and androgen receptor problem. The dominant driver of hair thinning, particularly in a pattern distribution, is a molecule called dihydrotestosterone, or DHT. This is not a straightforward testosterone story. It is a conversion story. Your body has an enzyme called 5-alpha reductase. This enzyme converts circulating testosterone into DHT, a significantly more potent androgen. DHT then binds to androgen receptors located on the hair follicles of the scalp. When it does, it initiates a process called follicular miniaturization. Each successive hair growth cycle, the follicle produces a slightly thinner, shorter, more pigment-poor hair until eventually it stops producing a visible hair altogether. This is androgenetic alopecia, the most common form of hair loss in both men and women, affecting approximately 50% of men by age 50 and up to 40% of women by age 70, according to data published in the Journal of the American Academy of Dermatology. The pharmaceutical benchmark here is finasteride, a 5-alpha reductase inhibitor. At clinical doses, it suppresses circulating DHT by roughly 60 to 70%. That level of suppression appears to be the threshold at which follicular miniaturization stabilizes and, in a significant percentage of cases, partially reverses. Finasteride is effective, but it carries a documented side effect profile: sexual dysfunction, mood changes, and, in a subset of patients, a condition now called post-finasteride syndrome, that makes many people want to explore other options first. Here is where a specific food compound becomes genuinely interesting. Pumpkin seeds, and more specifically pumpkin seed oil, contain a class of phytosterols known as delta-7 sterols. These compounds have been identified as natural 5-alpha reductase inhibitors. The early biochemical data, including mechanistic studies published in pharmacological journals, suggests that these sterols can suppress DHT production by approximately 30 to 40%. That is below the finasteride threshold. I will not pretend otherwise, but it is still a clinically meaningful reduction, particularly for someone in the early stages of thinning rather than advanced loss. But here is the part that makes pumpkin seed phytosterols more interesting than just a weak finasteride alternative. They also appear to act at the receptor level. A 2018 study published in Pharmacology and Pharmacy examined delta-7 sterols from pumpkin seed oil and a pumpkin seed extract and tested their competitive binding capacity at the androgen receptor. The same receptor DHT binds to on the hair follicle. The results showed dose-dependent competitive binding. What that means in plain terms is that these compounds can physically occupy the receptor site that DHT would normally activate. So you are getting a two-pronged effect: reduced DHT production upstream and reduced DHT signaling at the follicle, regardless of how much DHT is actually circulating. That is a fundamentally different mechanism from finasteride, which only targets production, not receptor occupancy. The clinical data is early but promising. A randomized, placebo-controlled trial published in Evidence-Based Complementary and Alternative Medicine enrolled 76 men with mild to moderate androgenetic alopecia and administered 400 milligrams per day of pumpkin seed oil for 24 weeks. At the end of the trial, the treatment group showed a mean hair count increase of 40% compared to 10% in the placebo group. Important caveat: the capsule formulation included proprietary additional compounds alongside the pumpkin seed oil, so this was not a perfectly clean single-ingredient trial. The findings are directional, not definitive, but the signal is strong enough to take seriously, especially given that the intervention carries essentially no documented adverse effects. Now, pumpkin seeds also provide zinc, a mineral that plays a supporting role in hair health by modulating androgen metabolism and supporting keratinocyte function. A systematic review published in Dermatology and Therapy in 2017 noted that zinc deficiency is significantly more common in patients with androgenetic alopecia than in controls. Supplementing zinc alone does not reverse genetic hair loss, but the deficiency angle is real and worth addressing. Practical guidance: if you want to use whole pumpkin seeds, you need a meaningful quantity, around 80 to 100 grams per day, to achieve the phytosterol concentrations used in the research. Pumpkin seed oil in capsule form, standardized to delta-7 sterol content, is a more efficient route to the 400 milligram target used in the clinical trial. Give it a minimum of 3 to 4 months before drawing conclusions. Hair growth cycles are slow. Beyond pumpkin seeds, there are other compounds worth knowing about. Green tea catechins, specifically epigallocatechin galat or EGCG, have also demonstrated 5-alpha reductase inhibitory activity in cell studies. A study published in the Journal of Investigative Dermatology found that EGICG promoted hair growth in human hair follicle organ culture and extended the anagen phase, the active growth phase, of the hair cycle. The mechanism appears to involve both 5-alpha reductase inhibition and WNT/beta-catenin pathway activation, which stimulates follicle stem cell activity. 2 cups of quality green tea per day, or a standardized EGCG extract, is a reasonable adjunct to pumpkin seed oil if you want to cover multiple mechanisms simultaneously. Saw palmetto is another compound that appears regularly in this space. Meta-analyses, including one published in JAMA Dermatology in 2020 reviewing evidence across 7 trials, found that saw palmetto improved hair counts in a majority of participants. The effect size is modest, but the compound is well tolerated. Its mechanism also appears to involve both 5-alpha reductase inhibition and possible androgen receptor interference, similar in profile to the delta-7 sterols in pumpkin seeds, though via slightly different phytochemical pathways. Part 2. Gray hair, oxidative stress, stem cell loss, and reversibility. Gray hair and thinning hair are completely different biological problems. I want to be very clear about that because people often conflate them or apply the same interventions to both. Hair color is produced by melanocytes, specialized cells that synthesize melanin pigments and deposit them into the hair shaft as it grows. These melanocytes do not live forever. They are continuously replenished through each hair growth cycle by a reservoir of melanocyte stem cells located in a region of the follicle called the bulge area. As long as the stem cell reservoir is intact and functional, the follicle keeps producing pigmented hair. Graying happens when that reservoir is disrupted. 2 primary mechanisms drive this disruption. The first is oxidative stress. Research published in the International Journal of Trichology demonstrated that gray hair follicles show significantly elevated levels of hydrogen peroxide and other reactive oxygen species compared to pigmented follicles. This oxidative environment damages tyrosinase, the key enzyme in melanin synthesis, and directly injures the melanocytes themselves. Over time, the oxidative burden erodes the pigmentation machinery at the cellular level. The second mechanism is stem cell exhaustion or premature differentiation. Studies published in Applied Sciences and Nature examined melanocyte stem cell behavior under chronic stress conditions, both oxidative and inflammatory. They found that elevated reactive oxygen species caused these stem cells to either differentiate prematurely, losing their stem cell identity and therefore their ability to regenerate melanocytes, or to physically migrate out of their follicular niche altogether. Once those cells leave, the follicle loses its capacity to replenish the melanocyte population. Sitting beneath both of these mechanisms is mitochondrial function. A study in Cell Regeneration showed that mitochondrial dysfunction, specifically impaired electron transport chain activity, leads directly to increased reactive oxygen species leakage into follicular tissue and suppresses melanocyte stem cell maintenance. This is important because mitochondrial health is something that is deeply modifiable through lifestyle, and it connects gray hair to the broader picture of metabolic health. Elevated blood glucose, insulin resistance, chronic systemic inflammation, all of these increase mitochondrial oxidative stress, and all of them accelerate graying. Now, here is what most people do not know. Graying may not be as irreversible as once thought. A landmark study published in eLife in 2021, the one that got a lot of attention, did something quite clever. Researchers analyzed individual human hairs, digitally mapping pigment density along each strand, essentially creating a timeline of pigmentation history. They then cross-referenced this with participants' self-reported stress history over the preceding years. What they found was remarkable. Some hairs showed clear evidence of repigmentation midshaft. Gray sections that had regained color after graying had already begun. These reversals consistently aligned with periods of reduced psychological stress. What this tells us is that the pigmentation machinery is not necessarily destroyed when a hair turns gray. In at least a subset of cases, it is in a suppressed or dormant state. Remove the stressor, reduce the oxidative burden, and it can reactivate. This is not a universal guarantee of reversal, but it demolishes the idea that graying is always a one-way door. A clinical study in Applied Sciences tested a polyphenol blend on cultured hair follicles under chronic oxidative stress and found statistically significant reductions in both the proportion of gray hairs and the density of gray hairs per square centimeter after 4 months of treatment. This represents early but genuine clinical evidence pointing toward reversibility being possible with the right antioxidant support. So, what do you actually do about gray hair? You target oxidative stress systematically. First, the foundational layer. A nutrient-dense, whole food diet with minimal ultra-processed foods, refined carbohydrates, and added sugars is not optional here. It is the baseline. Metabolic dysfunction is a potent driver of systemic oxidative stress. Every gram of excess sugar you eliminate is reducing the reactive oxygen species burden on your hair follicles. Vitamin C, vitamin E, selenium, and zinc are the classical antioxidant cofactors, all well documented in supporting melanocyte survival. Second, N-acetylcysteine, commonly known as NAC. This is a precursor to glutathione, your body's primary intracellular antioxidant. Glutathione depletion in the follicle is directly implicated in melanocyte damage. Multiple dermatological studies have examined topical and oral NAC in the context of oxidative stress-related skin conditions, and the mechanistic rationale for its use in gray hair prevention is solid. NAC at doses typically ranging from 600 to 1,200 milligrams per day is well studied for safety and widely available. Third, NMN, nicotinamide mononucleotide. This is a precursor to NAD+, a molecule that is central to mitochondrial energy production and cellular repair mechanisms. NAD+ levels decline significantly with age, and this decline is associated with impaired mitochondrial function, exactly the dysfunction we identified earlier as a root driver of both follicular oxidative stress and stem cell deterioration. A 2022 study in the Journal of Cosmetic Dermatology found that NAD plus precursor supplementation was associated with improvements in hair quality metrics and reported a reduction in gray hair progression in a subset of subjects over a 6-month follow-up period. The data is preliminary, but the mechanistic pathway is very well established. Fourth, CoQ10, or coenzyme Q10. This molecule sits inside the mitochondrial electron transport chain and acts as an electron carrier. When mitochondrial function is compromised, electrons escape the chain prematurely and react with oxygen to form superoxide, one of the most damaging reactive oxygen species. CoQ10 helps electrons move through the chain more efficiently, reducing this leakage. It is one of the best validated mitochondrial antioxidants, with a long safety record and strong mechanistic rationale for application in oxidative, stress-driven conditions. Fifth, sleep quality. This is non-negotiable. Cellular repair, antioxidant recycling, and stem cell maintenance all occur primarily during deep sleep. Chronic sleep disruption elevates cortisol, increases systemic inflammation, and directly impairs mitochondrial function. Glycine, 3 grams at bedtime, has shown in controlled trials to improve subjective and objective sleep quality, possibly through thermoregulatory and GABAergic mechanisms. It is inexpensive and extremely well tolerated. Sixth, psychological stress management. Given the direct evidence from the 2021 eLife study showing that graying reversal tracked with stress reduction, this is not a soft recommendation. It is mechanistically supported. Breathwork, specifically slow-paced diaphragmatic breathing at a rate of around 5 to 6 breaths per minute, has been shown to activate the parasympathetic nervous system and reduce cortisol levels acutely. Practices like this done consistently over weeks and months do appear to reduce basal inflammatory markers. Bringing it together. The practical protocol. Let me give you the framework in clear terms. For hair thinning, the primary intervention is pumpkin seed oil at 400 milligrams per day from a standardized extract, or a daily intake of around 80 to 100 grams of whole pumpkin seeds. Consider adding green tea catechins, 2 cups daily, or an EGCG supplement, to target the WNT pathway and add another layer of 5-alpha reductase inhibition. Saw palmetto is a reasonable third layer if you want additional androgen receptor modulation. Timeline: minimum 12 to 16 weeks before meaningful assessment. For gray hair, the foundation is metabolic health and antioxidant support. Remove refined carbohydrates and added sugars. Prioritize vitamin C, vitamin E, selenium, and zinc through food first. Add NAC at 600 to 1,200 milligrams per day, CoQ10 at 100 to 300 milligrams per day, and if budget allows, an NMN supplement at 500 milligrams per day. Protect sleep with glycine at bedtime, and take the stress reduction evidence seriously. It has direct mechanistic support, not just associative correlation. The two protocols overlap in several places. Zinc from pumpkin seeds supports both. Sleep quality and oxidative stress reduction benefit both, and metabolic health improvements have downstream positive effects on androgen metabolism as well. None of this is pharmaceutical-grade intervention. I am not pretending it is. But the mechanisms are real, the compounds are documented, and the safety profiles are favorable. If you are in the early stages of either thinning or graying, starting here before exploring pharmaceutical options is a completely rational, evidence-informed approach. I will link related videos below if you want to go deeper on any of these individual mechanisms. If you found this useful, share it with someone who needs it. I am Dr. Daniel, and I will see you in the next one.